Hassan College, India, I'm going to present on the role of virechana as a purva karma of virechana in management of sthaulya, which is obesity, prediabetic symptom. First of all, I want to thank you, Rao sir, to give me a chance to present here a presentation on Ayurveda. For understanding the best aspect of Ayurveda, I want to give first introduction of Ayurveda before starting my presentation. So Ayurveda is one of the world's oldest holistic health system, which was discovered in India. Ayurvedic medicine is a system of health of traditional Indian medicine system. Ayurveda is derived from Ayurveda during the Vedic period. The god of Ayurveda is Lord Dhanvantari. The picture of Lord Dhanvantari is here. The principle of Ayurveda, the way of life, is swasthasya swastha rakshanam aturasya vikara prashanam. The quote, it means that the aim of Ayurveda is to maintain the health of healthy person, but as well as to treat the ailment of sick person. This is the main thing, the principle of Ayurveda, a way of life. Next, I am coming to the origin of a body, or we can say composition of body. And many pathis agree with this quotation that our body is made of Panch Mahabhutas. It is Akash, space, Vayu, air, Agni, fire, Jala, water, Prithvi, earth. Next slide is very important in Ayurveda. It is three dosha aspect. So in Ayurveda we feel that our body is composition of Panch Mahabhut, three dosha, sap, seven dhatus, and the three doshas are Vata, Pitta and Kapha. The Vata role is main to all sensory part, all motor nervous system, or body movements, sleep, thinking process is due to Vata. Otherwise, there is no Vata will be there, it will be not possible. And the second thing is Pitta, the all metabolic rate, all metabolism of Agni, of digestion system, of eyesight, of anabolism, catabolism is due to Pitta. Next is Kapha. The all synovial fluid present in a body, cerebral fluid, liquid part is due to Kapha. This chart is showing that Vata is ether and air, Pitta is water and fire, Kapha is due to earth and water. So next I am coming to the treatment, the Chikitsa part of Ayurveda. We believe two types of treatment. One is Shamana and another is Shodhana. So it is difficult to understand for Shamana because I translated in English also. Pacification of vitiated doshas. Doshas are nothing. They are the imbalance, impurities of our body. Shodhana, Panchkarma, which I am taking a part today, that cleansing of a metabolic waste. I am going to discuss in further slides what is a Shodhana and Panchkarma. So you can say biopurification of body. So Panchkarma. This is showing the introduction of Panchkarma. 5 treatment modalities: Vamana, Virechana, 2 types of Basti, Nasya, and what we do is Purv Karma, pre-operative, Pradhan Karma, operative, Paschat Karma is post-operative procedure, the preventive, curative and rejuvenating. So all you saying must be thinking, why Panchkarma, why I am talking about Panchkarma, what is Panchkarma? So this is your answer. Method of biopurification through natural orifins, unique treatment of modalities. Unique treatment of modalities means we can change our modalities according to person. It can vary one person to another person. We can change the treatment. We can do a special treatment for different body type, because in our system we think and we believe that one person body system is different from other body person. So unique treatment modalities are there. A real pathogenesis breaker, na punurbhava means long lasting effect. It will be not like that after having some days medicine of antibiotic course or something else, but it finishing the course. It is not that. It is the means to, we are clearing the root cause of that disease. So today we are discussing three aspects, preventive, curative and promotive. We are not discussing only curative. This is the only from among 5 modalities. I am taking only one. Virechana is a therapeutic purgation for pitta, mainly downward expulsion of dosha through anal route by taking medicine. Diabetes, skin disease, digestive disorders, mouth ulcer, eye disease, headache, constipation, jaundice, etc. can be treated by this panchkarma. This modality of treatment is virechana. So this is a picture how the drugs during this process we administrate to the person, how they look like. Some of them are powder, some of them are liquid, some of them in tablet form. Now I'm coming to the diabetes and metabolic disorders. The prevalence of pre-diabetes, it is syndrome has skyrocketed and it is 61% in last decade. From the country which I came is India, so southeast countries like bearing most of burden of this disease. Clinical trial proved evidence of benefit only the people with pre-diabetes. All the people who develop this disease always go under phase of pre-diabetes. It can vary from length of the that period person to person. This is the picture which showing the part most of population who are suffering from this diabetes or this disease. So targeting people with pre-diabetes, lifestyle intervention should be aimed at people with the pre-diabetes. We're talking since yesterday, life intervention should be there. So Madhumeh, in Madhumeh, it's diabetes mellitus. Madhumeh is a word from Ayurveda. So has been mentioned as one of the sequel of obesity. So before Madhumeh, it is obesity is coming to the person. It is alarming effect. It is alarming time for the person to make sure that it should be changed. For obesity, one of the line of treatment is virechana, which I am talking and which I am taking today. In obese patient, there is a fear that snehapan may further increase dyslipidemia. I am taking two groups of patients in research work we taken. One is a snehan and a rukshana. The rukshana is a purva karma prior to snehan, particularly in condition like obese patients. So objective of this study to assess the efficiency of virechana performed by using classical snehan purva karma in pre-diabetes. To evaluate the role of virechana performed by conducting rukshana drying therapy as a purva karma prior to snehan, oilation therapy in pre-diabetes. To ascertain whether performance of rukshana prior to abhyantara snehapana in virechana provide better relief in pre-diabetes by comparing both of the groups. Material and methods. A source of data is taken 30 patients from OPD and IPD of SDM college, Ayurveda Hassan are taken. Method of collection was that the 30 obese patients who were under with or without first degree relative suffering from type 2 diabetes mellitus were selected for the further detailed investigation as per the following inclusion criteria. So this is the inclusion criteria and exclusion criteria by which we can explain the people who are being through this process by two different groups. Plan of study. The selected patient were into two, already told you, group S and group R. Internal oilation means snehapana and direct drying therapy means rukshana. So So group S, the Snehapana group, this is a medicine. Murchita Grit was administered orally in the increasing dose till the Samyak Snigdha Lakshanas were observed. It means that the Murchita Grit is a medicinal grita which is available in Ayurveda medicines. It is given to the person and it is observed what is going after effect. Swedhana, the Sarvanga Abhanga with Murchita Tela and Mridu Bashpa Swedha was given in 3 gap of days. That some steam process will be there. For Swedhana is denoting the steam process. After this, we'll give patient is introducing to the Swedhana. So virechana karma with the Rechak Vati is a name of a drug which we introduced to the patient. In dose of 2 tablets was performed by classical method. Tarpanadi Samsarjan Karma depending on the Shuddhi. It means, this line means that we will wait for the symptom which we are needed there for patient. It is not like I'm giving a person for 5 days. It is not possible to, it can vary person to person. It can be 4 days, 5 days, 6 days or 7 days. So group R, Rukshana. What is the difference we given? The diet is rice and wheat chapati was replaced by chapati made by barley. The patient was advised to take buttermilk 2 times a day before meal. Drug. The patient was administered Trifla, the name of drug, orally in 50 ml 3 times a day before meal. Simultaneously, Udvartan is a dry powder massage with Trifla Adi Churan was done over all the body. All the above diet drugs were given simultaneously for 7 days till Samyak Rukshana Lakshanas was observed. The same that we will wait for the Lakshanas to appear and then we can understand whether we have to go further or whether we have to pursue the treatment which are we doing. So Snehapana Murchita Grit was administered orally in increasing dose till Samyak Snigdha Lakshan was observed. It is increasing dose, like today we are giving 30 ml, tomorrow it's 60, then 90, then 120. It is not the same dose we follow for every day. Swedhana, Sarvang Abhyanga with Murchita Tela and Mridu Bashpa Swedha was given in 3 days. Virechana Karma with the Rechakvadi and 2 tablets of carried out with the classical method. Samsarjan Karma, it is a post-operative measurements which we do is Samsarjan Kala. In technical language is Samsarjan Kala according to Ayurveda. So Tarpanadi Samsarjan Kala depending on the Shuddhi. The purification of that body is done or not. It is not like I already told you, it can vary person to person. We have to wait for 5 days, we have to wait for 6 days, might be 7 days, or it can be done in 4 days also. But the body language, the body type is different. One person is different from another person. So assessment criteria on basis of fasting blood sugar, BMI, OGTT, lipid profile. So coming to results, this is the significant results. This table showing you overall improvement with Sneha, the S group, Snehana Purva Karma Virechana. So you can see the significant result on BMI, OGTT, LDL, VLDL and triglycerides. But in next presentation, in our group, it is more beneficial for the patient. So by this we can say Rukshana is more significant therapy before going for a Snehapana. So we get more results in Rukshana group. So discussion, I am coming to discussion as sthaulya, obesity is the Bahudosh Pradhan Vyadhi. It is a multiple disease disorder. Biopurification is the first line of treatment which should be adopted for increased kapha pradhana dosha, which are brought to coast by Snehan and Swedan, are expelled out by virechana. Thus, Rukshan Purva Karma, Snehan and virechana help in the expelling the doshas in larger quantity and reduce the sign and symptom of pre-diabetes, which is very necessary. Virechana medicines get absorbed due to virya, the potency. It reaches to the heart, hridaya, then to the dhamnis, blood vessels, and thereafter it reaches to the macro and micro channels of the body. Due to Ushna Guna, the compactness of dosha, disease occurring particle, is liquefied. Action of a Tikshan Guna is break the mala and dosha and their quick exertion. Due to the Sukshma Guna, endogenic toxic are excreted through the microchannels, mainly due to the Prabhava, Prithvi, Jala, constitution and presence of Saraguna. Virechana occurs. This is the evacuate action. Rukshana has antagonistic nature to the Medha and Kapha, Abeschi and Kapha. Thus, Rukshan Purvakam Virechana does added beneficial to the Shodhana, biopurification. It means that by this only we can understand how it is more beneficial in Rukshana group than a Snehana group. So, by conclusion, Rukshana Purvaka Virechana, Snehan Purvak Virechana provide better relief than respect to all subjective and objective parameters. Rukshana Purvaka Virechana has better role on providing relief to the patient of pre-diabetes, sthaulya. Rukshana Purvak Virechana therapy proved very significant in weight management and reduction of glucose lipid profile. Ayurveda has very broad and synergetic view of understanding the pathophysiology of treatment principle for obesity and consequences. By this, I would thank you to all. Go natural, live Ayurveda, go green, and it is a time to, it's alarming time we can do before we can control diabetes before it occurs. Okay, thank you.
Thank you very much. Very interesting. Do you have any questions or comments? Yes, please. Microphone.
Yeah, it is there. I told you that virechana is a treatment which we do in different type of disease. It is not like only diabetes is we controlling diabetes. We doing pitta management. Under pitta, many disease like eyesight, like metabolic system, like digestion, like weight loss, all come together.
How much was the mean weight loss?
It again varies person to person. It is depend on the type of body. It is vata, pitta, kapha, or part of two things, vata, pitta, pitta, kapha. And minimum we recorded 3 kgs in a span of 7 to 10 days, and it can goes to 10 to 12 kgs. It can goes, and it already it depend on the body type, and it depend on the precaution we taking care. Whether patient is going to a proper channel of treatment, whether he is not breaking rules which are told by the doctor, and this is the thing.
Well, in the scheme of things, I think you should do two different things. One is do a population-based study to show that people of cardiometabolic diseases cluster under pitta. It should, theoretically. And that has not been done. And the second thing that you have to do is these type of studies should be randomized studies and take totally blind approach to show whether or not this working and establish appropriate statistical data. Because Ayurveda has been used for thousands of years, yet we do not have clinical data to support any of our findings. We assume that it all came from God and so it's good. But in order for us to present in this type of situations and in good journals, you need a larger study, well planned. Thank you.
Thank you, sir, for your suggestion. And
Okay, so thank you very much. Here is your certificate, please. Thank you.
I want to have a picture.